Good morning, good afternoon, and good evening, wherever you are dialing in from in the world. My name is Jerry Antimano, and I am the Community Development Manager at HITLAB. Welcome everybody to another Women's Health Tech Wednesdays. We had a bit of a break, and now we are going right into season 4, or the second half of 2022 for Women's Health Tech Wednesdays, and we are happy to have everybody join. As always, I would like to make sure that everybody knows that we'd love to hear about where you're from and who you are in the chat. So please do feel free to introduce yourselves. And the Q&A box is also live. So please feel free to put any questions in there you'd like to ask our wonderful guest today. And on that note, without further ado, I'm going to introduce Delphine O'Rourke, partner Women's Health at Goodwin, and Kaitlin Christine, CEO and founder of Gabbi, who are going to carry our conversation today and kick off season 4 of Women's Health Tech Wednesday. So wonderful to have you both on. Delphine, I'm going to hand over to you to carry the conversation today.
Jerry, thank you. And thank you to HITLAB for inviting us today to talk about the role of employers as catalyst and innovation for women's health, and for everyone who is joining us. And I see people are putting their info in the chat, which is great for this Women's Health Tech Wednesday. And I think I speak on behalf of Kaitlin and myself. If there are questions that we don't get a chance to answer, we are virtual, so you can't sort of just come up to us at the end of the presentation. Please reach out to us on LinkedIn. I'm happy to engage. And if you don't know the answer, we can direct it to someone who may. I'm not going to be providing direct legal advice, but can direct you again to someone. So just want to say thank you also to Goodwin and Witham for being our sponsors today. These are important topics, and without sponsorship, they wouldn't be moving forward. So as Jerry mentioned, I'm a partner with Goodwin in our women's health and wellness practice. We are dedicated to providing legal advice to founders, established companies, and investors in the women's health and wellness industry space. And I love the upbeat music that we were hearing while everybody was convening, because this is such a positive topic. And to see the advancements that we are making in the women's health space, in large part because of founders like Kaitlin.
Thanks, Delphine. And again, my name is Kaitlin Christine. I'm the CEO and founder at Gabbi. I have 9 years of experience in women's health, specifically in the cancer genetics space, as well as in sales. And I started Gabbi based off of a personal mission, and I have now been the CEO and founder at Gabbi for 3 years now. So excited to have this conversation, Delphine. And disclaimer, I would say, is that Delphine and I actually get to work together on a regular basis. Goodwin, Delphine and her team represent Gabbi and myself in our legal counsel.
Which makes all of it even more fun. And also just put in a plug for HITLAB is we have a lot of mutual connections through HITLAB and met through another founder in the ecosystem. So just can't stress enough the importance of developing relationships, the importance of being part of this ecosystem. I think it's a really supportive community, and organizations like HITLAB and others are really intentional in bringing founders and investors and advisors and lawyers together so that we can all, build a better future for women. So
absolutely. And Delphine, I'd just love to add in there, I think as a founder, it can be really difficult to determine what are the value adds organizations, what are the places where I'm actually going to have great networking opportunities, and which ones aren't worth my time, because there are so many, and I feel like there's new ones popping up every day. And I just want to agree with you and further say that HITLAB is an awesome resource, and that's why we continue to participate, because it has in fact provided amazing introductions to you, for example.
Thank you. And I think, and so, again, another plug for HITLAB is coming in the fall. But I would say, somebody said this to me recently. They said, attending conferences, health conferences could be a full-time job because there are so many. So which ones do you really focus on where you will get the substance, which is, critical in all different types of areas, but also make those connections. I don't refer to it as networking because that sounds transactional. I mean, Kaitlin and I are to the point where, we exchanged, we were kidding earlier today that we were both wearing the same glasses on a call yesterday. So I changed mine up, is to really develop those relationships that are going to be supportive and bring you to the next level, whatever your next level is. So talking about the next level, one of the big trends that we're seeing in women's health is direct to employer go-to-market strategies. So the strategies are initial go-to-market. We're seeing more and more founders, and then we'll talk about the investor employer perspectives, more founders saying, okay, I have a direct-to-consumer strategy I want to add to, or launch both out at the same time. One doesn't preclude the other, but there are a lot of benefits to when you're trying to scale. And also to Kaitlin's point, you have limited resources. A strategy where you have to go out and engage a consumer, one consumer at a time, depending on your model, can be incredibly time consuming and difficult to scale. So,
and costly.
And exactly, and costly, so a lot of benefits to the direct to employer, particularly if the employer is self-insured. So Kaitlin, you want to share the founder perspective on that? And I know, again, you and I have worked on that as part of Gabbi's strategy.
Yes. So first, a little bit about Gabbi. We're on a mission to increase early detection so that cancer is not a fatal disease. We're starting with breast cancer, and Gabbi aims to be a woman's on-demand breast specialist. So we've harnessed AI to accurately predict a woman's risk of breast cancer using claims, medical data, and user-reported information. And within our app, Gabbi guides women on a personalized journey to help them understand their risks of breast cancer, provide a personalized care plan, and navigate the women who are most at risk to an early detection in less than 7 days. So knowing that that's the basis for our company, I went through many exercises of determining what was our go-to-market path. And it started with, let's go straight and sell to the health systems. And that was mostly because that's where my experience came from. And everything I say is very specific to Gabbi, so take it with a grain of salt. But for us, I wasn't willing to work with those incredibly long sales cycles, as well as the number of stakeholders that you have to get buy-in from. And because healthcare is very archaic still in the United States, it was going to be a huge uphill battle. So then we started thinking about the consumer strategy. Well, many of the things that you called out, Delphine, it being expensive, taking a lot of time, and just difficult, it didn't make sense to do that either. And what happened was we came to the conclusion that selling to payers was actually kind of the holy grail at the end of this journey. But in order to get there, oftentimes, especially for a solution like Gabbi, they're looking for outcomes. And the only way we were going to be able to prove outcomes was with actual users. So you could go direct to consumer, or you could go to self-insured employers. And that is where we have settled. So our go-to-market strategy is selling to the self-insured employers, which for individuals who don't know what that means, think of that as any of the large corporations that we all know and hear of today. Everything from Nike to Amazon to Facebook, they're all self-insured employers. And what that just means is they manage their own health plan. They have a pot of money. Instead of paying a monthly premium to a health insurance company, they are pulling out of their own funds the care that is used for their employees. So what that means also for them is at the end of the year, they're very cognizant of how much money they spent, how much money they saved, and they're always trying to save more money because it's their money. And for us, because we are able to offer cost savings, finding an early diagnosis saves a lot of money compared to a late diagnosis. The stars just aligned.
You bring up a couple really great points there. And so let's, this direct to consumer, we're not in any way suggesting that there isn't a role for that.
Right, absolutely.
Gabbi and a lot of platforms, I, as a consumer, can still go and say, this is something that's important to me. And whether or not my employer is covering it, I want to engage. I want to, whether it's a per member per month or a subscription plan, this is important to me. I want to be able to detect my breast cancer risk and then act on it. So I engage with Gabbi. What we're talking about is sort of parallel plans. Now, you might have, I believe there are a lot of founders on this call, you might have a solution that really only lends itself to an employer platform. And one of the advantages, I mean, there are multiple advantages to an employer platform, but it's, again, if you have if you contract with an employer, you're ideally contracting with an employer who then is going to offer that service to anyone who is qualified. So let's say you have 50% in this case, and breast cancer isn't just a cancer that affects women, it does affect women predominantly. So if you do have an employer who, let's say 50% of their workforce, and when you're in the women's health space, that's key. And you want to look for a workforce, a company that has a high percentage of female employees. That doesn't mean that others won't be interested, but if you're trying to prioritize your targets, what are those companies that are going to be A, self-insured, B, have a high percentage of women? And saying that if you are able to obtain that contract and you're positioning yourself, to Kaitlin's point, how is this a cost savings? How is this going to improve the quality of your employees' experience? How is this going to attract them? And we're going to talk more about that piece. But if you're able to contract with an employer, you all of a sudden have sort of a population of potential engaged employees. And that's when we start getting into sort of population health management. It's not population health management in the way that the government sometimes talks about it and saying, we're going to manage this entire population of Medicaid, entire population of Medicare, but it effectively creates population health management through the employers. And the employers can offer that platform. Again, not everybody has to take it. Another advantage is that employers are more and more willing to pay for services that are not covered by insurance.
Mm-hmm.
And there are certain services that are just not billable to commercial payers yet. So commercial payers, your Blue Cross Blue Shield, your Aetna, your Optum, et cetera, you can't bill Medicaid and Medicare because the government programs don't cover it. So it's an out-of-pocket cost. And what we're seeing is more data analytics that's being performed by employers. And if you're pitching to employers, this is information that you want to have available and ready, more than available, that you want to lean into and say, yes, this is out of pocket. And yes, you're going to have to pay X per employee who engages in this. But look at the survey, look at the savings on the claim side. So, for example, if women are able to detect their breast cancer risk and get preventive care rather than having to have a double mastectomy, look at the claims data.
Right.
So that can be really attractive. And because we find generally as a trend that, Americans will spend a lot more, and there's a lot of data to support this, on cosmetics than they will on out-of-pocket health costs. And we can have a whole session on that. Why? Part of it is this perception that it should be paid by insurance. And if it's not being paid by insurance, then why do we need it? And really changing that mindset. Insurance can be, the floor. Sometimes it's more than the floor. But a mindset of, if insurance doesn't pay for it, either I don't need it or I shouldn't pay for it is to use Kaitlin's word, archaic.
Right.
So,
well, and Delphine, just to jump in there, I think something that you're bringing up is all these different revenue models. And I think that's really where there's some neat innovation going on with the self-insured employers. And there's a very interesting opportunity. So typically, a self-insured employer, a benefit that they're going to bring in is charging the startup, let's say, or the solution is charging a per member per month or a per employee per month. There's so many different ways that you can slice the pie in order to be, and this is very much from the founder perspective, in order to get some early employers. So whether that's saying, hey, you don't want to pay for every single person that would receive Gabbi at your company, you want to only pay for the employees that are actually using Gabbi. So there could be a per user per month, or you can charge a per member per month, or you can do a percentage of cost savings. You can bill claims. There's all these different ways that you can be creative with how to structure the revenue model. Now, whether or not the employer is going to agree to that is another thing, but it at least presents to the employer what we've learned. We participated in EHIR Academy, which is an employer health innovation roundtable. And one of the things that we learned from there is you have to be flexible. So coming in with saying, we charge X dollars per member per month, and that's it, doesn't always go over well. They may want to talk about other revenue models and ways that they will compensate you for the service. At the end of the day, they may still end at per member per month, but they want to know that you're willing to work with them, because again, at the end of the day, they want to see how much they're going to be saving, how it's going to engage their employees.
And then, and that's, you have several levers, and this gets to, my role in these conversations in negotiating contracts, negotiating models. The payment per month isn't the only thing you want to think about. Where is the risk shift? Yep. Who's taking responsibility? Risk sharing, risk shift, who's taking responsibility? I saw a quick thing in the chat about health information. Who's going to be responsible for, the privacy piece? In many models, the employer never sees the data.
Yep,
and that's
exactly.
Part of, and that's something that employers are going to ask. If I contract with Gabbi, for example, or excuse me, if my employer contracts with Gabbi and I take advantage of that benefit, will my employer see what my risk of breast cancer may be? These are questions that you need to think about, and the answer, unless that's part of the model that the employer, for whatever reason, is looking at that data, and that's very transparent to consumers, the employer shouldn't be.
Right.
You're contracting with a third party, which is part of the reason it makes it attractive to employers. It's saying, okay, this is something we'll contract with. We will offer it to our employees. We've vetted it, and we're going to talk about vetting and some of the challenges there, but the employer is not getting that information. And that's so important for many reasons, including the fact that there's studies that have shown that employees are reluctant to provide personal information, health information, behavioral information, if they think their employer is going to see it. Which is, hey, understandable. I mean, we're not talking about an American, an ADA process. We're not talking about a process where you're looking for disability accommodations. If you just say, yeah, I drink every night, and that's somehow going to, that's going to impact your cancer risk, you don't necessarily want your boss to know that. So when if you're going to have an employer strategy, and I work with clients on structuring them, is, okay, what's critical to you? Let's look at your risk. Let's look at costs. Do you really need the results? Is that important to you if you're starting out and you want to make sure, again, not on an individualized basis, so you know what Joe, Jane, and Jack are doing, but you see overall, okay, what are the outcomes that came from this? So one of the challenges, though, for employers, and something to really think about, is employers, because now there's this, oh, wow, employers can really be impactful. And, one great example is fertility is, and I think it was Maven put out a study on this, that before COVID, only about 5% of employers had any type of fertility benefit, and now we're at 15. So you might say, well, 15 isn't that many. Okay, but from 5, that's a pretty significant increase. And we're seeing that once a large employer, takes a benefit or offers a benefit in the industry, often peers will follow. So it's like, get that first one, and then in professional services, and the market follows.
Yes, absolutely. And Delphine, speaking about getting that first one, because it can be difficult. And in my mind, when you're thinking about going direct to consumer versus going to self-insured employers, and not that they're mutually exclusive, but you can have to go and have to get a single woman, you're getting woman by woman, or go get a self-insured employer who, let's say, even has 10,000 employees, half of them are women, you can get 5,000 females. So some insights to look for that I would recommend when you're looking to get going with employers is, first, that you have to do a lot of studying and understand how self-insured employers work. And then as you start getting more specific on the types of companies that may make sense for you, it's who are the key decision makers? What are who are the people that have to sign off on this? And then what is coming up with something, and I would recommend in combination with some of the employers, but you'll have to have an initial proposal at first of what is an easy lift for them. And that's something I want to really impress, is that you're going to have to work your butt off to get a first customer, a first employer customer, and you're going to have to hold their hand, because if you don't provide the best experience, they will not either turn into a paying customer or they won't give you a good recommendation. And so this is a lot rests on this. So making sure that you are providing the best possible customer service communication that you can, and then also structuring something that you as the startup can handle. So knowing that, yes, it would be amazing to get 100,000 employee self-insured employer, but could you handle that right now with your 3-person staff? No. And if you fail, you'll never get that opportunity again. So bite off something that you can chew, and don't even ask to expand it to the entire employee population. Perhaps set parameters that maybe it's just women between this age and this age who are actual employees. You don't include the dependents.
That's a great point. And it goes back to preparing and knowing your audience, and whether it's the risk tolerance, whether it's, if you're proposing something that's going to be changed to their benefit plan, well, make sure you know when that time frame is. When are they making changes to their benefit plan? Because if it isn't from 8 months from now, we talk about long contract cycle with health systems. That doesn't mean you don't contract with health systems. You're just in your strategy saying, okay, I know this one's going to take 9 months. I know this one just changed their benefits plan. Go in and say, I know this isn't part of a benefits plan. This is an add-on. And then think about their pain points. And when we get to pain points, privacy is a big one. Again, as an employee, I'm like, do they really need to know all of this information about me? Do I want them to know? How do I make sure it doesn't get into my personnel file, et cetera?
Totally.
And another one is,
go ahead.
Is it recruitment? Look at the industry. Is this an industry that's publicly saying we don't have, and this applies to women, but it applies to other sectors as well. Are they saying we're part of this great resignation, we're trying to recruit more accountants? We know that I'm making these numbers up, but 20% of our accountants are women. We want more women accountants. Google, what are they saying in the news? Try to get as much information. And then if you're pitching and that's an issue, then lean in with that and say, this is going to be great to attract talent. This is going to be great to keep your talent happy and make sure your talent stays with you.
Yes, and I think what you're saying, Delphine, is ultimately research. You need to know who you're selling to and personalize it to them. So, with this example that you're giving, perhaps this is an account. You need to look up, what is the socioeconomic status of the employees at this particular, where are they mostly located, and develop some of their pain points so that you can create a sales pitch, if you will, that's completely targeted to that. And on top of that research is finding out what is off cycle and what is on cycle. So Delphine, you kind of alluded to this, that there are very clear sales cycles for employers when they are willing to adopt new benefits. And there is a very distinct period at each company where they will look for new benefits. And then there's a very distinct period where you can show up at their doorstep and they won't pay attention to you because they're getting ready for, maybe it's open enrollment, or they've already made their decisions for the following year. So you really have to know when that is. However, figuring out if your solution is something that can be offered off cycle, in which case you have a little bit more option on when you can give your sales pitch and potentially win a customer. There are a few questions coming in about claims data and privacy. And I'm not sure if this is specific to Gabbi or just if you are a solution and you need to get claims data, how can you do that with privacy concerns? And so Gabbi does in fact or get access to claims data, but it's not necessary. And what I will say is that that is a common practice that self-insured employers, or common requests rather, that they'll be asked for claims data. Yeah. And it's all anonymized and de-identified. And it's something that they work with their health plan. They put in the request to the health plan. Typically, then there's an additional ask that goes to the Ben admin, the benefits administrator. And it can be something as basic as an Excel file that's sent. There's other ways that it can be sent, but it's anonymous and de-identified.
And that's claims data. That's a great question. And something, you know, talk to your lawyer, talk to your counsel about that. What kind of claims data do you need? Make that part of the negotiation. How important is it to you? Does it need to be, you know, it's going to be de-identified. I mean, it's unlikely that they're going to give you individual claims data. But when you get back to what do you need at the end of the day from this contract? What are the benefits? It's not just about the money. Can you use that claims data to model for another company? So but we want to move over to continue to move over to Q&A. So I'll say, you know, just broadly on the trends, and something to think about is, you know, Kaitlin referred to people knocking on their door. So I think we're going to continue to see an increased role in employers in health benefits for a variety of reasons, including purchasing power, including a desire to decrease costs, including, you know, COVID has shown how intricately linked employers are with employees' health. And that there is a bottom line conversation about if your employees are not healthy, they will not be productive. There's an impact on, we mentioned, we are in a crisis for talent. How will this impact our crisis? And for innovation, it's really an excellent opportunity, particularly in women's health. This is a theme across our economy. How do you attract more women? One of the challenges that you can overcome, you have to be very intentional, is the employers have so many people knocking on their doors saying, I can do this for you, I can do that for you, I can do that. And they're saying, well, I don't know which ones to. And we haven't gotten to consolidation yet. And well, that's going to be part of our ongoing discussions. And I said, Goodwin, we're going to be doing an event on consolidation in September. But until we have more consolidation, employers are being just inundated with solutions and saying, well, how do I figure out which one I should actually engage with, which one has the outcome? So, Kaitlin, love to hear your thoughts on how you distinguish yourself and then move over to Q&A.
And that's exactly it. You have to distinguish yourself and set yourself apart. I think the first way you can do that is research. If you create a personalized, targeted sales pitch for that specific employer, that's going to be a lot more powerful. I think at Gabbi, we have a really unique wedge, if you will, in the market, because every year a company is looking for something to do in October for Breast Cancer Awareness Month, and they currently don't have solutions for solving early detection. It usually ends up being painting the office pink and you know, giving incentives to go get your annual mammogram. So we have a really unique advantage and wedge there. However, I would just again say it's setting yourself apart. Make sure you've done your research, and don't underestimate the value of building a relationship or using your relationships and network to find different key decision makers and stakeholders within the organization. It is wildly important to build relationships with them and leverage the conversations and relationships as you're building them, so that by the time you're giving a sales pitch, everyone inside the company is talking about you, that they're seeing you on LinkedIn, that they're talking about you in their internal meetings, and Gabbi comes up at their weekly check-in meeting. And that's when the progress will start to happen, so that everyone's excited about what you're doing and helps you further get in the door.
Great way to wrap up. We have half an hour. This is obviously a conversation that could take several hours. It's just sort of an intro. And again, be prepared. Be prepared with your pitch. Be prepared with your legal analysis. You know, I see too many clients going in and saying, oh, we pitched to our dream client, but we never had it reviewed by legal. And when they said, have you had legal review? We said no. And they said, nice to meet you. Bye-bye. Right. So be prepared, go in, practice, and feel free. This is, you know, employers are, again, huge catalysts. They're interested. They generally have the money if they're talking to you and looking to be partners in your journey. So again, thank you to HITLAB, and please reach out to us on LinkedIn, follow both of us, and more to come. And please follow Gabbi. And, you know, what Kaitlin and her team are doing on the women's breast cancer side is truly revolutionary. So again, thank you to everyone who joined us today.
Thank you, Delphine. Great conversation.
No, thank you both for coming on. A really, really fantastic conversation. We're getting a lot of positive feedback from the crowd, of how fantastic a topic this is and how important it is that you both are covering it. There's definitely more to unpack, but unfortunately we are at time. But Kaitlin and Delphine's LinkedIns are in the chat. So if you want to reach out and discuss more, please do feel free to reach out to them. I'd like to remind everybody that this is a strong kickoff to season 4 for Women's Health Tech Wednesdays. Next week, we're going to carry on that trend and have Catherine Scobie and Gina Williams from Pfizer. And of course, we have our Digital Health Symposium at the end of the month, driving health access and equity in healthcare. So please look in the chat for more information and how to register. And it goes without saying, a huge final shout out to our wonderful guests to kick off this season of Women's Health Tech Wednesdays, Delphine O'Rourke and Kaitlin Christine. Thank you so much for your conversation today and kicking this season off. And of course, thank you to our sponsors, Goodwin and Witham, without whom this conversation and the future conversations would not be possible. So thank you to them and their undying support, of course. And thank you to the audience for coming in and joining us again for another Women's Health Tech Wednesdays. So it's just up to me to say good afternoon and good evening, and hope you all have a great rest of the day and see you next week.
Bye.
Bye, thank you.
You guys.